The NeoSal Oral Fluid Collection System is an easy-to-use oral fluid collection device for laboratory-based drug screening. The NeoSal's unique design features allow for maximum ease of use when collecting oral fluid samples and ensure stability of the sample prior to laboratory testing. The NeoSal includes two components: an oral fluid collection pad intended to collect the sample, and a buffer tube intended for stabilization and storage of the sample prior to laboratory testing. The unique features of both components will be explained in more detail in the following scenes. The NeoSal collection pad is intended to collect oral fluid by placing the pad between the cheek and the gum. The NeoSal's unique cap-style handle allows the saturated collection pad to be easily inserted into the buffer tube following collection, preventing the need to separate the collection pad from the handle. The NeoSal collection pad contains no oral fluid-inducing stimulants, which eliminates the undesired salty taste produced by other collection devices. The NeoSal's built-in Sample Volume Adequacy Indicator, SVAI, will turn blue when a suitable volume of oral fluid has been collected. The typical collection time is 1 to 2 minutes. The NeoSal buffer tube contains a proprietary buffer which is intended to recover drug analytes from the collection pad and ensures stability of the oral fluid sample during transportation and storage at the laboratory. The unique design of the buffer tube allows for easy removal of the cap and convenient storage of the cap in the bottom of the tube. This enables the laboratory to easily access the additional buffer tube cap when the sample arrives at the laboratory for processing. The buffer tube design also allows for tamper-proof tape to be used if required by your laboratory. Collecting of an oral fluid sample using the NeoSal is completed by following these simple steps. 1. Prior to collection, have a timer available to ensure collection is completed before the maximum collection time of 10 minutes. 2. Ensure the donor has not ingested any food, liquids, chewing gum, or candy at least 15 minutes prior to collection. 3. Explain the collection process to the donor prior to starting the collection. Check the expiration date on the NeoSal device. Follow any additional collection or chain of custody instructions provided to you by the testing laboratory. 4. Have the donor inspect the expiration date on the device, and then open the packaging and remove the NeoSal using the white plastic handle. The donor should be careful not to touch the pad or have the pad touch any surfaces. The SVAI will have a visible line in the clear plastic window prior to collection of the sample. This line will turn blue when sufficient sample has been collected. 5. While holding the white plastic handle, the donor should take a few seconds to pool or accumulate saliva prior to inserting the NeoSal in the mouth. This pooling process will help provide the most efficient results. 6. While holding the NeoSal handle, the donor should insert the collection pad between the cheek and gum line at a slight downward angle, with the SVAI facing outward or away from the donor's mouth. Instruct the donor to leave the clear plastic window with the SVAI outside of the mouth and visible during the collection process. Instruct the donor not to talk or bite the device during sample collection. 7. The donor should keep the NeoSal in their mouth until the SVAI forms a distinct blue line across the clear plastic window. Typical collection time is 1 to 2 minutes. 8. While the NeoSal is in the donor's mouth, the donor should remove the buffer tube from the packaging, record donor information on the buffer tube label, or follow the donor identification and chain of custody procedures established by the testing laboratory. 9. While holding the buffer tube in an upright position, the donor should unscrew the blue cap to open and push the blue cap into the bottom of the buffer tube for storage. Do not discard the blue cap. The donor should be careful not to spill or remove the liquid from the buffer tube. 10. Once the SVAI forms a distinct blue line across the clear plastic window, instruct the donor to remove the collection pad from their mouth. The collection pad should then be inserted into the buffer tube. The donor should twist the white handle tightly into the buffer tube to secure. Once the collection pad is secured into the buffer tube, the donor should gently invert the tube 4 to 5 times to thoroughly distribute the buffer solution onto the collection pad. The sample is now ready for shipment to the testing laboratory. The sample can be stored at room temperature prior to shipping to the laboratory. Thank you for choosing the NeoSal Oral Fluid Collection System. For technical assistance, please contact our Technical Services Department at 859-254-1221 or email toxicology@neogen.com. Representatives are available Monday through Friday from 8 a.m. to 6 p.m. Eastern Standard Time, or contact your laboratory directly.